Wrapping things up now, we need to look into the different blood typing. So I've gone through all the formed elements, we've gone through the plasma, but how do you type blood? Because I'm willing to bet you've heard of A blood or B blood or AB blood or O blood. Well, blood itself is typed based on cell surface markers. So humans have about 30 different recognized groupings of these. So these are all naturally occurring right in the red blood cells, and they're on the surface of the red blood cell. Really, the ABO, which is what you've heard of blood typing for, is typically the one you hear of because that's the one that causes extreme reactions if they're not matched properly. Rh is also a factor. Rh is why you have positive and negative blood types. So other groups like MNS, Duffy, Kell, Lewis, they're there, but they're not usually used in more emergent situations when you're talking about blood transfusions. They're used more when you have the time to type things out and match things up as appropriate as possible. They also don't have the same reactions, so they don't have as concerning. Where if the ABO ones are mixed up, that's a pretty immediate reaction. The blood simply just clumps up and turns into a gel a lot of times. Not really good if you're trying to help somebody to turn their blood into a gel. So of the Rh factors, there's a total of 50 different ones. Now these Rh factors, the Rh comes from the term rhesus macaque actually, a monkey, because they originally discovered the positive and negative Rh factors on studies from rhesus macaque monkeys. So C, D, and E are the most common, but we focus on D because that's the one that has a clinical importance. That's the one where if you mess that up, it starts to really have a strong reaction. So if you have, for example, A positive blood, that positive means you have the D antigen present. This D marker is there. So let's look at how we do this. Now here I have A, B, and O. I'm going to throw these up full screen so you can really see all the parts and pieces that are going on. So first off, with the A blood, we're going to put A antigens on there. So these are the cell surface markers. Now they're not really triangles, but I can't draw out three-dimensional chemicals on your screen. So let's go with the triangle that symbolizes the A antigen or A cell surface marker. B type blood has the B antigen or B cell surface marker, the B antigen. So for blood that says it's AB, do you think it might have the A and the B antigen? Sure. Has both the A and the B antigens on its surface. But now O, well, it's not the same, so O doesn't have the A or the B antigen. Now I have none under it. None as in there's no A antigen, there's no B antigen. It doesn't mean none as there's no antigens at all. There are still antigens, just not for blood typing. All right, that's one half of the equation. The other half are the antibodies. Now remember, antibodies are going to recognize the antigens. Antibodies are floating in the blood. They recognize things that are usually marked for destruction, things that shouldn't be there. So in this case, these antibodies, A antibodies, B antibodies, do you think you want to have an A antibody recognize an A antigen? No, it wouldn't be a good thing. Because if the A antibody recognizes the A antigen, it'll mark it for destruction. So should the B antibody recognize the B antigen? Again, no, that would be a problem. Instead, you have the B antibodies. So these are the B antibodies. Those antibodies will be found in the A blood because the B antibodies will not recognize the A blood cells. So when it's in your body, that means your antibodies will not attack your own blood cells. So in the type B blood, do you think you should have the B antibodies? No. You want the A antibodies. Now in the type AB blood, did you want the A antibodies? No. Do you want the B antibodies? No. So that means the AB blood does not have either of the A or B antibodies. But the type O blood, could that have the A antibodies? Sure, because it doesn't have the A antigen. Could the O blood have the B antibodies? Sure, because it doesn't have the B antigen. So that means in the O blood, you can have both A and B antibodies because there's no antigens to recognize for A or B. All right, now try work on the positive and negative aspect. Let's take the AB and make it positive. I just put this square antigen on the surface. The square antigens are symbolic of the D antigen, so the Rh positive. That means this blood type is AB positive. If the D antigen is present, the blood is Rh positive. If the D antigen is not present, the blood is negative. So what we're really looking at here is looking at the antigens present. If you have the A antigen and nothing else, you are A negative. If you have the A antigen and the D antigen, you're A positive. If you have the B antigen and nothing else, you're B negative. If you have the B antigen and the D antigen, you're B positive. If you have the A antigen and the B antigen, and those are the only two, AB negative. If you have the A antigen, the B antigen, and the D antigen, AB positive. If you have the lack of A, the lack of B, the lack of D, so no antigens, you're O negative. If you only have the D antigen, O positive. And then we mix in the antibodies. Make sure the antibodies are always the opposite of the antigen. So for example, on this type A cell here, it's A negative. You can have the A antigens, but the B antibodies. So that's what you're looking at for blood typing, ABO system, positive and negative. This chart tries to kind of summarize things, showing you which antigens are present, which antibodies are present, and what type the blood is compatible with. Because if you're looking into blood donation, you gotta think about, okay, well, which one can accept what? So if you're looking at, for example, this A blood, A can accept A and it can accept O. Well, it makes sense because O doesn't have the A or the B antigen. But if you want to be more specific, A negative can accept A negative blood, O negative blood. But when you start getting into A positive, that means now you have the Rh factor. You can accept A negative or A positive, O negative or O positive. So the idea here is O negative is the universal donor. Question is why? O negative doesn't have the A antigen, doesn't have the B antigen, doesn't have the D antigen, which means there's nothing on its cell surface to react with any of the other bloods. So those antibodies in the other bloods can't recognize it. No issues. AB positive is the universal recipient. It can accept any other blood type because that blood already has the A antigen, B antigen, and D antigen. They're all present, which means any other blood won't react because there's no antibodies to any of the antigens. So you're looking at blood type in that case. Now, if you're putting this into a tray and trying to actually sample it out the blood, this is only an A and B one. This is not for the Rh factor also. But if you put the same blood on both trays, both spots here, and then you put an A antibody into well 1, mix it up, and clumps agglutinates. That means the A antibody, the anti-A, the A antibody, found A antigens. Then over here you put the B antibody, or the anti-B in, and it clumps. It found B antigens, which means that has the A and the B antigen. That's type AB blood. Let's do the next one. You put the blood in again. You put the A antibody in. It clumped. It agglutinated. That means it found the A antigen. But over here, You put the B antibody in, anti-B, and no reaction. It did not find the B antigen. So that means A was present, B wasn't. This is type A blood. Let's try the bottom one. Put the A antibody in, nothing happens. Put the B antibody in, nothing happens. That means you didn't find the A antigen, you didn't find the B antigen. That's type O blood. O does not have A or B antigens. And the same thing works if you're testing for positive and negative, the anti-D antigen and the anti-D. So when we look for the anti-D, look for the D antigen with the anti-D antibody. If it clumps, D is present. If it doesn't clump, it's not present. So if I was to add on to this one right here, a third well, and call this anti-RH. So we put the blood in here, and it clumps. So this is clumping. Now this blood type, we notice over here, no reaction. Means there's no A. We notice here, there's a reaction. We have the B antigen. We notice here, there's a reaction. There is the D antigen. That means that would be B positive blood. Two reactions, these both reacted, means the antibodies found the antigens, B and D. So it's B positive blood. So you're looking at how the antigen and antibody are reacting, trying to figure out what the blood type is. One last thing to kind of go through, hemolytic disease of the newborn. Now in hemolytic disease of the newborn, it will start off with the firstborn child, but will impact the second and later children. Now this will only occur if the mother is Rh negative and the father is Rh positive. So that means the mother's blood type has a negative sign, the father's has a positive sign. Now, if that new developing baby, while still in utero, has a positive blood type, throughout the pregnancy, no issues. Upon birth, sometimes the mother's blood and the basic birthing baby's blood mix. Those positive Rh antigen blood types get into the mother's blood. Won't harm her, but you'll say, hey, these shouldn't be here. Her body will recognize it and make Rh antibodies. Won't do a thing to her, no problem. But she is now sensitized to Rh factor. Which if she has a second child, and that second child is also Rh positive, then her antibodies will cross the placenta and attack the new blood of that developing infant. So it's important to make sure that if there's a case of the mom being Rh negative, dad being Rh positive, you try to prevent the formation of the Rh antibodies. And that's where this drug Rogam comes into play. Rogam will prevent the mother from forming these Rh antibodies, which means any subsequent child wouldn't have to worry about being attacked by Rh antibodies. All right, so let's blow this up full screen here. What you're seeing up top here, this is the placenta. You're going to have both the blood from the mom and the infant coming close but not into contact. So we take this little piece here and blow it up. What you're seeing is initially, upon birth, the mom's blood and the infant's blood are going to mix. That initial mixing, because those tiny capillaries are rupturing during birth, it happens. Upon mixing, the mother will make antibodies to recognize the Rh positive blood. It won't hurt her, won't do anything to her. But on the second exposure, so the second pregnancy, if that second developing fetus is Rh positive, those antibodies can go into the fetal bloodstream because they can cross the placental barrier. Now, mom's blood and the fetus's blood can't cross the barrier, but the antibodies here can. So if those antibodies get into the fetal bloodstream, they'll attack the Rh positive blood. So it's kind of a good thing to make sure that if the mother is negative, the father is positive, Rogam is used to prevent that potential issue there. So looking at blood typing and hemolytic disease of the newborn.